So, I mean, integrated care is just a way of saying joined up care. And I think what we're trying to do as a group of organisations is make sure that people, when they're going through the healthcare system, feel like their care is joined up. We've had a system that was invented about 30 years ago of commissioners and providers, and we talked about them being split, separated from one another. And I think one of the effects of that has been we've ended up doing things to people in the population rather than with them. So I think my ambition, my vision for integrated care is that we're actually doing what people wanted us to do. We want to work better together to join up the care that they get. There are lots of good examples of how we're already joining care up. We're doing a lot in our local neighbourhoods where perhaps GPs are working with the local social care department, they might be working with the police or the ambulance trust, and talking to people in those communities about how we can join up the care around them. And that's prompting some really amazing results in parts of Lancashire and South Cumbria. Inside a hospital, you might ask different professionals to work together to improve a pathway for someone when they need hospital treatment. But the other element to this is thinking about the future, planning for the future. We know that our population is getting older, for example, so people's needs in old age are perhaps different from how they were 20 or 30 years ago. And we can do a lot more for people, of course. We also have some really clear pockets of deprivation in Lancashire and South Cumbria, and we need to be taking some action over a number of years to really help people to address those and be healthier in the longer run. The takeaway message for me is that we should carry on being really ambitious. You know, I think people come to work wanting to do their best. They often talk about making a difference. And actually, in most people's day-to-day lives, they want to do that. They want to look after their patients, or they want to support citizens in the community. So this is about building a sense of community to improve all of our population's health.